further discussion? Representative Bruun.
Thank you, Mr. Speaker. To the bill?
To the bill.
Thank you. Colleagues, in this debate, we'll talk a lot about money sitting in Washington, D.C., and it is enticing, almost $1 billion a biennium. But make no mistake, this free money comes at a cost, a steep cost, and ultimately an intractable cost. The most obvious cost is the cost it will exact on Oregon's small businesses. Those businesses that choose to do the right thing, that now choose to provide health insurance for their workers. The businesses now doing the right thing are the same ones that will pay the price for the so-called free money that comes from Washington. It's not the hospitals that will pay. They negotiated a make-whole provision. It's not the big businesses or the unions that will pay. No worries, they're exempt. No, it's just the small businesses that will pay. Those companies that create and provide most of Oregon's jobs. But as the price of private insurance goes up, so that Salem can acquire this free money, please understand that the real price is that fewer of Oregon's small businesses will be able to provide insurance. And for those that are still able to provide insurance, their workers will see increased wage stagnation as these companies are forced to offset rising health insurance expenses. Higher health insurance costs equal lower wages. It's that simple. The free money from Washington will also exacerbate the Medicaid cost shift, which will be entirely borne on the back of private employers. Right now, Medicaid reimburses only 62 to 66% of actual costs. That means when a Medicaid patient sees a doctor, Medicaid only pays 62 to 66 cents for every dollar of cost. This results in a cost shift that may be the single largest problem in our colossally dysfunctional healthcare system. This cost shift is the extra, the premium, that private insurance and small businesses pay because Medicaid and Medicare don't pay the bills. By massively increasing our Medicaid dollars, colleagues, we will also be massively increasing the Medicaid cost shift, straight onto the backs of small business. And by choosing to use Medicaid as our means to decrease the number of uninsured, rather than a tax credit system where individuals shop for and own their own coverage, we assure that our disastrous third-party payer system will continue to handicap all real efforts at cost reform. But we shouldn't worry, many are saying. We will solve these cost issues because we're going to engage in, well, cost reduction efforts. Some of these efforts are embodied in House Bill 2009. Others will be accomplished through Oregon's new health authority. Well, optimism is good, colleagues, and contagious. If we are successful in these efforts, we will be the first in the nation. We will be the first in the nation to successfully use expanded government power and intervention to reduce costs and improve outcomes. Hasn't worked in California? It's emphatically not working in Massachusetts. Never worked with Medicare or Medicaid. But hey, this is Oregon. Things are different here. But this, I'm afraid, is not even the biggest issue, colleagues. The biggest issue is this. Once the genie is out of the bottle, we will never get it back in. Once the choices in HB 2116 are made and the newly created state powers in House Bill 2009 are implemented, any hope we have of market-based healthcare reform will be gone. State power will grow, private choice will shrink, and we will find ourselves ever more dependent on a system in which we have less and less control. Only the very rich few, as in England, will be able to avoid this system. The rest of us will see our personal liberties slowly replaced by state coercion, price controls, and rationing. I urge a no vote.